which have been researched and categorized as illegal or illicit, and therefore are not sold publicly. And these are drugs that are commonly referred to on the streets, like that the young people commonly refer to, even in a lot of songs, and these words are used in music, in movies. There are a lot of street names that characterize these drugs. So as professionals, we would look at illegal or illicit drugs under some major categories, and these categories are defined based on the effects of the drugs on the body. People use hard drugs because of the effects they get from these drugs. Some drugs are stimulating. They're called stimulants because they stimulate the central nervous system, be it the brain and the spinal cord. Some are depressants. They would depress the effect of these parts of the body. And then some drugs work as hallucinogens and others as inhalants. So when you say a drug is a stimulant, what effect do you get? We can use a drug like coffee to describe the effect of a stimulant. We know people that wake up in the morning feeling groggy, and until they get that cup of coffee or green tea, they don't feel like themselves. They don't feel like they ought to. But once they get that cup or a cup or two, they're ready for the day. They feel more alert. They're gingered. They feel pumped. Their brain is more active. They're more, they're ready to go. They just feel like they're ready to start their day. So that's what a stimulant. I would say a stimulant gingers you or gets you pumped and ready to go. That's the effect of stimulants, while depressants will calm you down. So you find some people that would use certain drugs because they get a calming effect from the drug. Hallucinogens are drugs that take you to another realm. So they take you to realms where you have unusual perceptual experiences, which some people like. So they want to be in that phase where they start to hear Fela's voice, or they start to hear God talking to them, or they start to hear one or two things, which actually is not real, because it's just that they have the medication, the psychoactive drug has triggered a part of the brain that makes it feel real, but it's actually not real. So in those moments they are having unusual perceptual experiences. And then we have the inhalants. So under the stimulants, we have drugs like, which on the street will be referred to as blow or coke or snow or charlie or banku or CK. So those are the category of drugs like freebase cocaine and crack cocaine. They fall under that category. And we also have drugs like ice or ice baby or crystal meth or mukanti. Those are also drugs under methamphetamine. So these are drugs that were not commonly seen in Africa, but now we're getting an influx from the West, because like I said earlier, anything happening in the West eventually ends up in Africa. We have drugs classified as depressants, which calm people down, and we were very familiar with the cough syrup crisis that came up at some point. There was a big uproar and there was an issue about that. But that's a classification of drug where you have cough syrup which contains codeine. Codeine is a depressant. People would take things like codeine or heroin, which is often referred to as Thailand white or brown Thai white or off-white. We have roaches and Refnol and bomb, and even injectables like pentazocine. These drugs are being abused by the young people. We have our good old cannabis that has been known from ages past. From many years ago, we are very aware of cannabis, which is commonly referred to as Igbo and SK and Kush and Kolos and Loud. But now we have an influx of newer drugs, newer hallucinogens from the West. We have drugs like LSD and Molly and truffles, and special mushrooms and ayahuasca, and so many of them, And amongst the inhalants, we have things like glue and petrol and surely. So we're talking about these things because young people now can access all this range of drugs even via the internet. We talk about people going online to order these substances from the comfort of their homes. So you have a young person in your house, who is always ordering food or ordering one thing or the other. As a parent, you might think they're always ordering food, but you might be surprised to find out that with that food comes certain psychoactive substances you're not even aware of. And now we know that there are certain designer drugs that exist. They call them designer drugs because they've been specially designed in the lab to be undetected or undetectable. They are what we call new psychoactive substances. These drugs are barely detected. It's only when we start to see the effects on the individual that we know that there's something wrong. So I'm just going to open the phone lines now, and I want our viewers to share with me street names that they're aware of before I move on to the signs we should look out for in addiction. So the numbers to call are 0703 2277 338, 0703 2277 338, or 0909 555 1039, 0909 555 1039. Moving on, I will now move on to I'll give certain reasons why people use drugs. It's important not to castigate or look down on everyone that we see that abuses drugs, because people use drugs for different reasons. The most common reason we're aware of is for pleasure or experimentation. So someone goes to a party, they're sharing drugs at the party, the person tries it at the party, so we feel that's how everyone starts to use drug. But that's not the only route. Yes, some people start that way, especially very young people. They're young, they're still experimenting. I talked about it in one of our previous series about how the frontal lobe is still not fully developed in a young person. So young people before the age of 25 are more likely to experiment with whatever it is. They're more likely to try out risky behavior because they are unlikely to think of the long-term consequences of their action. So they will try before they think, and later on now face the consequences, unlike an older person who would first weigh the consequences before trying it out. So experimentation or use for pleasure is one of the many reasons why people use drugs. You'd be surprised to find out that people also use drugs as a means of self-medication. So we could you can have a young person who is finding it difficult to sleep, who is in low spirits, who is unhappy, who is feeling very fatigued or finding it difficult to cope in school, and the person goes over the counter, just goes to a random unlicensed chemist to ask for medication that can help him sleep, and beknown to him, he might be sold a drug that might be addictive. And you find that he starts that medication, and in a matter of weeks he finds it difficult to come off that drug. So he tries to stop the drug, but it's difficult to stop because once he tries to, there are certain changes that occur in the body and make it difficult to stop the drug. So in that situation, an addiction has started, and as addiction is, it naturally progresses from one stage to the other. So sometimes people use for self-medicate. Sometimes it might not even be the chemist, it might be a friend. So a person confides in his friend and says, oh, this is what I'm going through. I wake up most days, I feel unhappy, I don't sleep well. And the friend is like, okay, try this. When I smoke weed, I sleep better. When I smoke weed, I eat better. When I do this, I feel better. And the person goes on to try it out, and you get that temporary relief. But this, because the drug is addictive, as time goes on, the drug becomes the master. The drug takes over the individual, and they can no longer function without that drug. So self-medication is one of the reasons why people use, and that's why as mental health professionals, when we get people coming to the clinic with an addiction issue, we want to dig in for the underlying problem. You don't want to just assume that they're smoking for pleasure. You want to dig deep and find out what the underlying problem might be. And a thorough assessment always reveals the underlying reason for use. Sometimes the individual might not even be aware of why they even started to use, but once you start and you dig deep and you do a thorough psychoanalysis, you're really able to dig deep to the genesis of the problem. And the truth is that once you hit or target the genesis of the problem, a lot of times they are able to beat the addiction, they're able to do better, they're able to live a drug-free life. So self-medication is one of the reasons. Another reason is accidental use, or I would say prescriptions or accidental use. So some medications in the medical profession, some drugs are controlled drugs, and they are controlled for a reason. They are controlled because they are highly addictive. So as medical professionals, we can use those drugs, but within a limited scope, within a limited period, and only when it is absolutely necessary. But sometimes, depending on what the client might be presenting with, especially people that present with chronic pain, so people with sickle cell disorders, people with cancers, people with pain disorders, lower back pain that doesn't seem to go away, sometimes some doctors might have to introduce them to some stronger medication, but the stronger the drug is, the likelihood of addiction is there, and some of those situations you find that people are on these drugs for months, for years, and when they now try to stop, it becomes impossible. It becomes very difficult to stop, and that's one of the reasons why we see a pentazocine, an influx of pentazocine addiction within the population, because you find that people now upgrade to injectables and higher opioids to cope. So this is also a reason why people use drugs. Another reason is learned behavior. Children growing up in households where they watch people they look up to or love use, smoke, or drink excessively can also see that as the norm. And if that's the norm for them growing up, why not engage in it when they get older? So it's not uncommon to see that when a child grows up in a household where the father smokes smokes cigarettes or drinks alcohol, you find the child picking up the butt of the alcohol to finish the butt of the cigarette to finish the cigarette, or finishing the father's glass after a social gathering. It's not uncommon to see such things. But the problem with that is that a 7-8-year-old doing that, by the time he gets to 15, 16, he's already drinking a lot, or he's already starting to smoke more. Now, in those days, our fathers were only exposed to maybe cigarettes and alcohol, but now, like I read out earlier, there's a long list of drugs to experiment with. So you find that at the end of the day, that cigarette and alcohol becomes a gateway to harder drugs. They get so used to the cigarette and alcohol that in a short while it ceases to please them, or it ceases to fulfill the pleasures that they want, and then they move on to stronger or harder substances, and then an addiction builds. Now, in terms of stages of addiction, people would initially try. So they might be somewhere with a friend at an event, and then they try the first time. A lot of people might try the first time and never go back. It happens. Maybe that first trial just didn't go down well with them, and they just never go back. But for some people, they take it to the next level, where they now go back to experimenting. So they didn't get it right the first time, but they go back and try again, and try repeatedly until they master the art. And then when they master the art, they now become regular users. So they now start to use maybe 2 to 3 times a week, and then gradually it starts to increase, and it becomes an everyday thing, But some people are functioning as regular users. A regular user will be someone that uses but is still able to function within the family, within the workplace, so they're still able to maintain a job, they can keep the job, they can work throughout the job, despite the fact that they have a habit on the side, But once it becomes a risky use or a risky user, he now starts to engage in high risk or harmful behaviors in favor of the drug. So we find someone that starts to drink before driving, knowing that getting drunk before a drive could lead to an accident, or even sometimes they even crash their cars, after drinking. But that shows that risky behavior has started to set in. So it's starting to become risky use. Someone not showing up at work because he's had a drink or smoked just before going to the office, or leaving the office at odd hours to go and use. So risky use starts to set in as regular use progresses. And then problematic drug use now is when they become dependent on the drug. So an individual can become dependent on the drug based on certain criteria. So when there's a compulsive use need to use the drug, so when the person hasn't smoked or drank, there's a strong urge, there's an intense urge to smoke or drink. So at that moment, there's a serious longing or serious urge, and at that moment they would do anything to get that smoke or that drink at that point in time. That is a compulsive use. And we find that over time the individual starts to use more, you increase the quantity of use just to feel high, just to feel good, just to feel that is effects they got the first time. So they might start with 2 bottles, and as time goes on, they're increasing the quantity to get the desired effect. For some people, they find that every time they want to stop or they want to cut down on the drug, they have unpleasant effects. So different drugs would produce different withdrawal symptoms depending on the class and the way the drug acts. So you find that every time they try to cut down or reduce, there are certain unpleasant symptoms that come up, and that reinforces the drug use. So because the person doesn't like the effect they are getting, they would naturally go back to use the drug again to feel better. There are also other signs we look out for, such as continued use despite harmful effects. So from regular use of drugs to risky use, to dependence, there's always an effect on first the finances. You're using these drugs every day, so there will be an effect on the finances. Aside from the finances, it can start to tell on the family life. So the relationships in the house will start to dwindle, or there will start to be issues in the home front. Maybe the wife is not very welcoming, they're having fights every day over the addiction, but despite that, the person continues to use. You can find that in the workplace, the person is not able to cope as they should. They're taking breaks from work, they're not able to keep up in the workplace. Everybody's in the meeting, in the boardroom having a meeting, the person has to get up several times to go and use. They can already see that happening, but they can't stop. For some people, health conditions might have set in, so they might have become hypertensive or diabetic or develop some form of cancer or one thing or the other, but despite that, the individual finds it difficult to quit. When you see those kind of situations, you know that dependence has set in. And in dependence, we see a loss of control. So the individual says, okay, for the next 6 months, I'm just going to smoke a cigarette a day. But the person finds that they exceed that target they've given for themselves, and they're smoking a pack or 2 packs in a day. They're so involved in the drugs, the drug just takes over. They're going anywhere, they have to put a pack in their pocket, they have to put a pack in the bag, because they're going to need it at several points during the day. So the drug there's this loss of control, and there's this need to satisfy the urge for the drug. And lastly, there's usually a neglect of other forms of pleasure. So the person would prioritize drug use over other previously pleasurable activities. So if it's someone that loves to hang out with family members or love to play golf or play tennis, they would rather spend time smoking than going out to engage in those activities. So that's another sign we see in dependence. So as professionals, we would always look out for these signs.
Yeah, hello.
Hello, good morning. This is the Legit Therapist Show. What's your name and where are you calling from?
My name is Ido. I'm calling from Ajabadere.
Good morning, Ido.
We've been talking on addiction. How can we spot someone that is addicted to a certain kind of drug? How can we really spot the person by merely looking at the person?
Okay, thank you, Do. We're going to address that as we go on. We're going to talk about the red flags to look out for. Please stay tuned to the show. And thanks for the call.
Okay. Thank you.
All right, so doctor, another case study. Chris, grew up seeing his father smoke cigarettes. His father is doing very well. Great man. He's his mentor. We have another caller?
Another call coming in. Okay. Good morning. This is the Legit Therapy Show. What's your name and where are you calling from? Hello? Okay, we lost that call. Please call again.
All right, so his father is a very likable person, and his father is his mentor. Everybody wants to be like their dad. Nothing ever went wrong with his dad. His dad lived a normal life. So he, growing up, saw nothing wrong with cigarettes, and probably alcohol. But eventually, he graduated to taking higher drugs.
Okay, let me read it out. Okay, so it's important for parents and caregivers. So I've met quite a number of people when I go to social gatherings. I see men, successful men, come to the party with their teenage son, maybe 10, 11 years. Okay, so sorry to cut you short. We have a message that just came in. So the message reads, "Good morning, Dr. Jibs. Very informative session. I'm just curious to know, when someone consistently uses a substance like vitamin C pills daily, can that be termed as abuse?" This is Atim from Lekki. So, Atim, yes, a drug like... Okay, there's a call coming in. Hold on, Atim, I would respond to you in a few minutes. Good morning, this is Legit Therapist Show. Your name and where you're calling from?
My name is Ifoma. I'm calling from Olayinka Jibunoh.
Good morning, Ifoma.
I want to say thank you for the issue. It's a very enlightening one. It's one of its kind. Never been attained by such a radio station like this before with such an informative idea about drugs. So that's a good one. Thank you very much for this. Now, this is my question. You've been elaborating so much about the drugs, types of drugs, its effects, how it originated and all of that, which is very, very good. I would like to also understand the type of alcohol as well. Are there different types of alcohol? Are there different levels of alcohol? Do they have any origination as well? And then if there are different levels or different grades or different types, how do you know them? How do you check them? Because generally, alcohol is just alcohol. I just want to know if there's way you can level them, just like you level the drugs effectively. Thank you.
Okay. Thank you, Ifeoma, for the call. Yes, there are different types of alcohol. So alcohol is usually, alcoholic companies have been mandated to quantify the amount of alcohol on the bottles.
Yeah.
So next time you pick up an alcoholic beverage, look at the bottle. There's always a percentage on it. So some of them would have 3%, 7%, 5%, but the highest legal and healthy is 40%, which you would see on your big brand spirits. So those spirits that people love to drink, whiskeys and brandies and cognac and all those things, are 40% alcohol. You see it written on it. The ones that I'm sure we remember, there was a time there was a crackdown on illegal alcohol manufacturing, the local logogoros and all that, because a lot of those things exceeded 40%. So that's why NAFDAC went after those people, because once it exceeds 40%, you are practically burning the liver. It's like once you drink it, it's frying. You have put your liver on a fry pan and it's frying the liver, and it's destroying it immediately. So that's why NAFDAC went after them, because it exceeded 40%. The legal height should be 40%. Now the issue is that at that 40%, the recommendation is a shot. So ideally, if you're going to even take the spirits, the big bottles, you should just have a shot, which is when they measure with the small cup and put a shot in it. That's the recommended amount.
Guys are drinking the entire bottles.
Exactly. So that's where there's a problem.
And they're popping it in the name of, being successful.
That's a problem. So you see, that's why there's a problem. So that is excessive, And then another way we quantify excessive alcohol use is how often you drink. So there are two types of drinkers. There are people that would drink every day. Let me not say two. There are people that drink socially, so they don't drink unless they're at a social event. They get their 1 shot, 2 shots, and they're good. They're fine. There are people that will drink every day, so they get back from work, they drink every day. They drink every day. They hit a bar, they drink. That's a problem, because I told you earlier on, as you take these things daily, your body starts to adjust. Your body starts to get used to it, and it becomes dependent on it. There are people that won't drink all week. They might not drink for a month. But the day they drink, it's like they just put a button that says start and don't stop. They just keep drinking and and they can't pause, and they don't know why they can't stop. So they will drink, they will take sick, they are drinking non-stop until they pass out. That's what we call binge drinking. Binge drinking is also dangerous. So if people come and say, oh no, I only drink once in a while, but when I drink, no, that is also a problem, because that once I drink too is also causing you harm. So we say there's controlled drinking. There's what we call controlled drinking. What is healthy drinking? When we say you should drink, a man should not drink more than 28 units of alcohol in a week. So units is the way we calculate it based on the percentage, but you shouldn't drink more than 28. But the important thing is that you should have at least 2 days in a week that you don't drink. So if you're one of those people that goes to a bar every day after work, 2 days in a week, you should be able to not go to a bar and drink. Because the more you do it, your body gets used to it, and you become dependent, and you find it difficult to stop. Now for women, we say 21 units. Women, our body is not, we as women don't tolerate alcohol as much as men do. So the limit for women is 21 units. You see some women that are going head to head with men, I can drink like a man, but really the body is not wired like that. So the recommendation for women is 21 units per week with 2 alcohol-free days. We also say that you shouldn't drink on an empty tummy. Very, very important, extremely important. A lot of people don't know that. So they start to drink and they haven't eaten and they're drinking excessively. When you do that, the alcohol gets absorbed faster, and the risk of overdose or taking too much in occurs faster. So those are the kind of people that you see. I'm sure you've seen some videos on social media where someone passes out after drinking. If they're drinking on an empty tummy, that's more likely to happen. So we advise that if you're at a party and you're drinking and you start to feel tipsy, that's the time to eat. I'm sure that's why you know that. You notice that when you go to drinking joints, there's always a suya man or a pepper soup man by the side. It's intentional, because once you start to get tipsy or you start to get intoxicated, that's the time to eat some more, so that way it slows down the absorption into your bloodstream.
All right, doctor. So back to what the first caller spoke about.
I want to respond to the question by Atim. So Atim had asked us that he takes vitamin C often. Is that addictive? So vitamin C is not an addictive substance. How do you know addictive substances? When you take them, there's a change. So I'll give an example. Some people sometimes get their drink spiked. They're at an event, they don't know, someone has dropped something in the drink. But what helps you know that the drink... Okay, we have a call coming in now. Okay. Good morning, this is Legit Therapy Show. Your name and where you're calling from?
Good morning, madam. My name is Alex and I'm calling from Surulere.
Good morning, Alex.
Yeah, I just heard you say that a person should not consume beyond 28 units of alcohol per week.
Very true.
So my question now is that, assuming a person has been consuming above 28 units per week, and it goes to what is called drug rehabilitation, something like that, what are the factors that contribute to what is known as a relapse? Maybe going after the treatment, he gets recovers from the addiction, and after some time, he resumes the addictive habit again. What are the factors that contribute to such things? Are there any scientific proven facts, or is it just the individual? Is the problem with the individual, or is it the environment? Or
Thank you very much. Thank you very much. I would answer your question in a few minutes. Thanks for the call.
Doctor, you have about 3 questions lined up now.
Yes, so let me just quickly run through them. I want to answer Atim's question about vitamin C. So he asked that he takes vitamin C often. Is it addictive? And I was trying to explain the nature of an addictive substance. You know, you might have a drink that gets spiked. You know, how do you know that drink has been spiked? Some people eat cake, and at some point they don't know that there might be, sometimes, what do you call them, the cake is laced with cannabis or one thing or the other, but after they've had it, they know that there's something else in this cake. Because why? There's a change in their mood, so they start to feel euphoric, they start to get high, they start to feel tipsy. You understand? There's a change in the mood, there's a change in the behavior. Maybe the person was very shy, suddenly they become more talkative, more disinhibited, more sociable. You understand? There's always a change. A psychoactive substance leads to changes in your mood, in your behavior, in your affect. So there's always that change. So you can always tell. Now, when you take vitamin C, there's no change. Or have you ever experienced a change with vitamin C?
No. You've asked yourself if it works.
I've never experienced any change. So that's how you know that it is not a psychoactive substance. Even Panadol, some people abuse Panadol. They take, it's an abuse still. You understand? Because they take it every day. But there's no change in the way they feel, in their behavior. So it is not psychoactive. The risk with vitamin C, high dose vitamin C, is the risk of forming stones. So it's like a chalky substance. If you're taking high doses every day, your body might not metabolize it as it should, and it goes in and forms a stone or a substance, a chalk in your body. And sometimes people that develop what we call kidney stones can be as a result of such substances, and they start to develop pains because there's something that has lumped up like a stone in the lining in the body, and then it starts to cause pain. You understand? So that's the risk of excessive use of vitamin C. So although it is not psychoactive, it also has its own effects, which might be painful as time progresses. The other caller had asked about risk of relapse. What are the things that can make someone that was drinking excessively, has gone in for treatment, relapse? We say treatment is a holistic approach. At the Freudian Center, we would look at a person holistically. You know, the approach is usually to have a biopsychosocial and spiritual approach to treatment. You know, so you would dig. You know, I told you earlier on, we'll always try to dig in for the underlying reason why the individual uses. Everyone uses for different reasons. No cap fits all. You cannot lump two people and say they use for the same reason. No, you assess each individual on his own merit and manage on his own merit. However, there are certain measures you put in place before they leave the rehabilitation center to ensure that all the efforts you've put in while they were under your care remains successful. So
like a change of environment.
There's so many things you factor into consideration. Sometimes some people are going into a toxic home environment. If the home environment is toxic, you have to put that into consideration, because you throw that individual back into a toxic environment, before you know, they are back, they're drinking again, they're smoking again. So that toxic environment is part of the underlying problem which needs to be addressed. Sometimes it's the work environment. So many reasons, but you need to identify the specific reason for that individual and manage appropriately. So I'll throw it back.
The first caller
asked
about what can you spot? How do you know if somebody's using, I think, red flags or something?
So the common red flags which you are aware of in the past, we say when someone smokes, their eyes will be red. You know, those things are almost changing now. You know, that's specific for cannabis. Cannabis would make the eye red. Marijuana would make the eyes red and they're a bit aggressive. But now people are even intoxicated, but their eyes are not red, because it depends on what they're using. So some of the other signs we look out for are spending habits. So if you find a person is spending money faster than they used to, that's something to query, because addiction even goes beyond drug and alcohol. Now there's gambling addiction, there's sex addiction. So with gambling addiction, they're gambling online. With sex addiction, they're patronizing commercial sex workers and spending excessively. So there are other kinds of addiction. So when you find that a person is spending money at a faster rate than usual, you need to question that. You need to check that there's a habit that is eating into their finances. When a person becomes more secretive and protective of their space, it's a pointer to a likelihood of an addictive behavior going on. When their erratic mood changes, that is usually a very, very common one. So one moment they are feeling this way, one moment people will just say, oh, this person has, meanwhile the person might be intoxicated 1 minute, and the next minute the effect of the drug is down and they're a bit anxious and restless and they're more paranoid than usual, and they're hyper and they're low. The mood just seems to be swinging from one area and you're wondering the person might just be on drugs. So that's one reason. For some parents will say this child has never been disrespectful, so suddenly the child is shouting at the parents and being very disrespectful. That can be a pointer to an addiction brain. So we have a text that just came in. It says, good morning, Dr. Jibs and Wale. Thank you for today's discussion. There is this popular concept that alcohol brings out the real person in someone. And personally, I feel more confident when I take just a little bit of alcohol. And I can handle any pressure better, and my thought flows freely too. I can freely take to anyone, and I see the best side of me interacting with others. I'm an occasional drinker and I don't drink often. Can I be said to have a problem? So in life we say everything, moderation is key. If you drink in moderation regularly, it's fine. It's okay. It's when it becomes excessive, because how we said you shouldn't exceed 28 units in a week. So 28 units in a week could be one shot of your spirits, a bottle of beer. I believe beers should range between 7%, 5 to 7.
Most is 5.5.
5.5 to about 7%. A bottle of wine will be about 12%. Yes, about 12%.
11.5.
So 12. Drinking a glass of wine, even medically, scientifically, the cardiologists say, a glass of wine with your meal keeps the heart healthy. There's a saying like that. So a glass of wine is 1 unit. I talked about 28 units. A glass of wine, a tall glass of wine is 1 unit. So having that 1 glass of wine occasionally with your meal is fine. It's okay. But if you have to drink the entire bottle to feel okay, it is not.
I think they're not sure NEPA will keep the light so it doesn't get bad. So they're trying to drink the entire bottle.
It's not fine if you have to drink the
entire bottle. I think part of the problem is how they're unable to store it back. That's the issue. So I think to avoid waste.
That is not the issue. The person enjoys what they're drinking, so they don't know how to put a control on it, so they continue non-stop. We have a call coming in. Good morning, this is Legit Therapy Show. Your name and where you're calling from?
Good morning, my name is Sosumi.
Good morning.
Okay, so my question is, some people take these things for inspiration. I've heard about a lot of taking drugs, to get inspiration or maybe some business idea. So for people like that, what can they do? Because they feel like if they don't take these drugs, they can't get inspired. So what can they do to get inspired without taking
Thank you for the call. So that's a characteristic of drugs under the hallucinogen category, drugs that make you hallucinate. Because when you are in another realm, hallucinogens take you to another realm. When you're in another realm, you feel inspired. You start to hear from your ancestors. You hear from the gods. That's an issue, but it's not a normal thing. We shouldn't be happy with entering other realms, because once you open up the gateway to hallucinations, you're already opening up the gateway to psychosis. And psychosis is the Oyibo man name for madness. So really, it's not something to be encouraged. You can still be inspired at a normal frequency. So a lot of us still get inspired. A lot of us are still very creative at a normal frequency. It's just about bringing yourself back and tuning yourself. If you're creative, you're creative. You don't need to be in another realm to be creative. So just quickly, because we're about to end the show, I'll just quickly run through the red flags to look out for. I said earlier on that people just look out for the red eyes and misbehavior in people, but that's not the only thing. It's only cannabis that really does that to individuals. But in other for other substances, you want to look out for spending habits. You want to look out for mood changes. You want to look out for the physical appearance and neglect of responsibilities. A lot of times when people start to abuse excessively, they start to neglect their responsibilities. They neglect their self-care, their sleep changes. They change their social circles, and we could also start to see onset of mental illness. So you find a family where there's never been a mental illness before, and a young person starts to exhibit signs of mental illness, be it anxiety, be it psychosis, or whatever, what have you. When these things start to come on, as parents, it's important for us to dig deep. Could there be substance use in this individual that is now bringing on a mental illness? So these are things that need to be looked out for. So we're hoping that this will be a multiple series. This is the first part of our addiction talk, and we'll talk more about it as we go on in the show. So we thank you all for listening today, and we see you again same time next week, 10 a.m. on Wednesday. Thank you very much.
This is the Legit Therapist on Law FM 103.9. This program is in association with the Freudian Center.
This is